San Diego News now.
Well, true golf fans will do just about anything to get out on the course, even if they have had a setback or two in life. Steve Quist from our partner station Channel 4 San Diego introduces us to one very special golf instructor who's making all of that possible. Steve?
That's right, Catherine. It's tough to make a living in golf these days, but John Klein has carved out a pretty good niche for himself that's kept him both earning a living for many years now, as well as getting a number of lives back on course.
On any given day, deep in the heart of Harbison Canyon, you'll find PGA teaching pro John Klein doing the one thing he's enjoyed doing for the past 33 years.
Here's your 3-wood straight back and up. Good, perfect.
John is a golf instructor, but not the kind you might expect to see at the range. He teaches adaptive golf.
There you go, good swing. As long as you can hold on to the golf club, I will create a swing for you.
Very nice. John, thank you.
Among the swings he's creating is that of stroke victim Tom Burke. John Stopier is a motorcycle accident survivor with 90% of his body pinned back together. There's 74-year-old Ray TARBOX, 2 months removed from his stroke, and Chuck Rose, whose entire left side was left paralyzed by a stroke 2 years ago.
I miss it terribly. It's been 3 years now since I played.
All golfed as many as 4 times a week before their injuries. 3 of the 4 now swing with just one arm as they try and relearn balance.
1, 2, 3, let's go. Okay.
Chuck Rose needs assistance just to get in and out of his adaptable cart, but once in the cart, he's on his own.
It's a lot harder than swinging with 2 hands when you can get up and adjust your body position real well.
You know, I keep it simple. Okay, remember to pronate. A lot of times there's memory loss, and so you have to be careful. You can't overload with information.
Chuck's specially designed cart allows him to drive the course independently while being able to face up to the golf ball. The clubs Chuck uses are the same as he used before his stroke, but this club helps him set the ball on a tee.
It takes a little bit of practice. Chuck picked it up quite easily, actually. Every once in a while you have to help him, but it makes Chuck feel more independent.
That independence can come with a price. Sometimes it can take Chuck a painstaking minute or two just to tee up one golf ball. But that constant struggle is seen as a good thing. He's working on his fine motor skills. He's working on his visual motor skills too, you know, trying to picture where that ball goes. He's multitasking, and it's really good for individuals who've had strokes to do that. For Tom Burke, it used to take 4 caregivers just to hold him up. Now look at him.
I used to be a golfer. I used to play every week, and so this gives me a reason to keep on going, keep going with the therapy. So I'm very, very thankful.
Some have made such good progress working with John, they can now put an able-bodied golfer to shame. Working with John is an extension of their rehab and quite therapeutic. We joke. Everybody's got a great sense of humor. Nobody takes life seriously anymore. You know, they've had their trauma, so now it's just a matter of go out and have fun. The goal is to one day have every one of these players back on the course as if nothing had ever happened.
I mean, you told me you played with a lot of your friends.
Yeah.
Obviously you can't now, but you think one day you'll get back to doing that?
Oh yeah.
So is that the goal?
Yep, I just got to get my handicap up high enough now.
A couple years from now I'm going to be walking and I can swing 2-handed then.
With John's help,
okay, perfect.
Anything is possible.
Right about here.
Klein runs what is known as Project 4 standing for Future Opportunity for Recreation and Enjoyment. And when the golfers you just saw in this piece feel up to it, they begin playing on a local par 3 course till they're ready to graduate back onto a regular course. Happy to report most of them do.
That's just terrific what he's doing. Just really great. I would imagine there's probably some folks out there that are thinking they know someone or maybe themselves who would really like to do this exact sort of thing. So do you have any information about getting in touch with John?
Right. John's not a big internet guy. He's been doing this for about 33 years, but he does work through the rehabilitation departments at Alvarado Hospital, Grossmont, and Sharp Hospitals. And during the week, you can always go on to Cottonwood over there at the driving range in Rancho San Diego and look for John. It's a neat little program. It was a fun story to do.
Oh, well, it is a great story. Thanks so much.
Thank you.